You could be so good at brushing and flossing. You could even be brushing after every single meal and flossing after every single meal, but you might still end up with that gunk on those bottom front teeth. That nasty buildup, especially on those lower front teeth, is called tartar or calculus. That's basically when you get this plaque or this biofilm of bacteria that builds up on your teeth, and then it gets hardened and calcifies, and that's why it gets stuck to your teeth. And a lot of times it happens to those lower front teeth. So why does this happen? Do you just suck at cleaning your teeth? Well, maybe, but the biggest reason is probably not because you suck at cleaning your teeth. The biggest reason is because you have saliva, and you have these salivary glands that are right in the floor of your mouth, right behind those bottom front teeth of yours. So that means that you have this constant flow of saliva, which carries a lot of minerals in it, right by those bottom front teeth. So that means that the plaque or bacteria that build up right in that spot can get those minerals so quickly, and that means that they can mineralize and turn into tartar really quickly. So right after you get your teeth cleaned, your teeth are gonna be super sparkly, and they're not gonna really have any plaque or bacteria on them at all, unless your hygienist didn't do a good job. But within 24 hours, you can start having plaque buildup on your teeth. That's pretty quickly, and that's why you need to brush and floss your teeth so that you can clear away that plaque buildup. And normally it takes time for this plaque to mineralize into tartar, because it takes time for that saliva and other minerals to incorporate with it. But in those lower front teeth, it's kind of an exception because they can start mineralizing a lot faster. Now you might say that, well, I brush and floss my teeth within 24 hours every time and I still brush twice a day. So shouldn't I still be cleaning away that plaque before it turns into tartar? Well, yes and no. Some people are just simply more prone to getting tartar because their saliva carries more minerals for one reason or another, and their tartar can build up a lot faster even if they do brush and floss correctly. So for those people, if you're doing everything else correctly, you might need to get cleanings even more often than every 6 months. You might even need to go in like every 4 months or 3 months. But there could be some other issues that are preventing you from properly cleaning those front teeth. For one, the tooth anatomy there is pretty weird. These are really small teeth and they're actually in a really hard to reach area, even if they're in the front of the mouth. You have your tongue right there, you have your floor of the mouth right there, and you have your lips right there. So it can make it hard to properly clean those lower front teeth. And you really have to angle that toothbrush, especially on the tongue side, to really get along the gum line of those lower front teeth. And you could just simply not be brushing those front areas enough. You could be brushing everything else really well, but you could be kind of gently going over these front areas and not really properly cleaning it. But anytime you miss those front teeth, then you also miss the plaque. And we know how easy it is for that plaque to turn into tartar, especially in that lower front spot. Your plaque is something that you can clean away at home. It's really loose and it's loosely attached to your teeth, so anytime you brush and floss it, it should come off really easily. But tartar, on the other hand, you can't really clean away because it's so mineralized, it gets stuck to your teeth. This is why your hygienist is scraping it off during your dental cleaning. Or they could be using an ultrasonic, which sprays water and vibrates really fast and still removes that tartar. But this tartar has to be professionally removed. You can't really remove it at home. So after you get your dental cleaning to remove this tartar, then it's really important to focus on keeping not just all your teeth clean, but especially those lower front ones if you want to prevent the tartar there. So how do you prevent this plaque buildup from turning into tartar? Well, you got to remove the plaque before it turns into tartar. So you know you're supposed to brush 2 times a day. But when you're brushing in the morning, I would definitely recommend brushing first thing in the morning when you wake up. Because you might think that you brush right before you go to sleep, so your mouth should still be clean. But that's not the case. You still get more plaque buildup in your teeth overnight. So you want to brush first thing in the morning to remove that plaque. Also, if you're a mouth breather or your mouth has been open all night, then you're going to have even more plaque. For one, because you have less saliva. Because when you breathe through your mouth, then you're drying up all the saliva in your mouth. I know I said that your saliva carries these minerals which will harden that plaque and turn it into tartar, but your saliva also has a lot of antibacterial properties and it can wash away a lot of the plaque too. So your saliva is still really important. So one thing you can do is using a mouth tape, which is literally just a piece of tape that goes over your lips while you're sleeping. The tape that I like to use is something called 3M micropore paper tape, which is literally this medical grade tape that you rip off a piece and tape over your lips to help encourage nasal breathing at nighttime. And this will also retain a lot of the saliva and even prevent morning breath and prevent your breath from smelling as bad. Now the second tip I have is anytime you brush your teeth, focus on those lower front teeth first. Don't focus on any other area first. Just focus on those lower front ones first. And you might even want to spend extra time in this area. Just spend like an extra 10 to 20 seconds brushing every one of those individual lower front teeth. Because you might think like, oh, I could probably get 2 for 1 because my toothbrush head is so big and these little chiclet teeth are so tiny. But no, the fact that they're tiny means that it's harder for you to reach them. So you want to focus on every single one, diligently getting every single nook and cranny of those lower front teeth. And it's probably going to be a lot easier if you use an electric toothbrush as well. Now with flossing, I'd still recommend flossing before you go to bed, but you might want to floss more often. Like, for example, you might want to floss after every single meal, at least in those lower front teeth, because anytime you eat, you're going to have food debris and plaque buildup on those teeth. And rather than letting it sit all day and possibly turn into tartar, then you could just floss after every single meal, at least in those lower front teeth, and then before you go to bed, floss all your teeth. But this will prevent you from getting that food buildup on those teeth and really prevent that tartar. And this is especially important right after a high carb meal or a high starchy meal, because those starchy carb foods are going to feed those plaque even more. You can also try adding something called an interdental brush or a proxy brush. This is really good for people that have spaces in their teeth. Like if you don't have really tight contacts, but you have like a really big gap, sometimes flossing just doesn't clean it as well as adding one of those interdental brushes. So next time you go to your cleaning, you can ask your dentist or your hygienist about it. They might even have some samples that you can take home. But all it is basically this little tiny brush that goes in between your teeth. For people that have really tight contacts, there's no need for you to do this because you probably can't even fit it in between your teeth. But you can also try adding a water flosser, which is just going to shoot a bunch of water in between your teeth to help loosen up any food debris or any remaining plaque. Now, another common area that you might be getting this tartar buildup is your upper molars, especially on the cheek side, because you have another salivary gland here on both sides that is also producing saliva. So those are the two most common spots to get tartar. Number one is those lower front teeth, and number two are those upper molars, which you might not know about. So those same tips I recommend for those lower front teeth to prevent that tartar, I do the same things on those upper molars as well. And actually, it's really important to clean all your teeth this way, but I would focus a little bit extra on those two areas. Now, if you're still doing all these right things and you're still getting a ton of tartar buildup and it's just not going away, you might need to talk to your dentist or your hygienist about another possible issue that you have. So make sure you go there as well. And they might, again, recommend that you come more frequently than every 6 months. But anyways, thank you guys for watching. I hope you liked that video and I'll see you in the next one. We've all had that feeling when you're lying awake in bed, watching the seconds go by, then the minutes go by, which turns into hours. And then you're just realizing how little sleep you're gonna get. We all know we need sleep. And this is why we get stressed out when we realize we're gonna have a bad night of sleep, because we're gonna be really cranky the next day. Now,